Hello there. I hope you are doing well this evening. My name is Dr. M, and I will be performing your cranial nerve examination today. Can I confirm your name and date of birth, please? Okay, good. So, in your appointment today, I'm just going to be walking through a series of tests with you to make sure your neurons and neurological pathways are all functioning as they should be, okay? Okay. So before we get started, I have just a few questions for you. Have you ever had a cranial nerve examination before? Yes, okay. And how long ago was that? Okay. And do you have a history of concussions or any other cranial injuries or issues? Some headaches? All right. And how frequently would you say those occur? Once or twice a week? Okay. And do you take any medication for those headaches? Yes. Okay. Just Advil? All right. And that makes it go away all better? Okay, good. All right. So we can go ahead and get started. What I want you to do for me is just scoot all the way up. Make sure your knees are at the edge of your seat. Uncross your arms and legs and keep them about shoulder width apart. Okay? Perfect. So the first thing I'm going to be testing today is your sense of smell. All right? Do you have a history of allergies, asthma? Okay, and have you been ill recently? No, good. And you haven't noticed any other issues with your nose? Okay, perfect. So I have some files on my table next to me that contain different scents, and we're just going to be testing your sense of smell with that. But first, if you can take a finger and place it over your right nostril and go ahead and take a breath for me through your nose. Okay, good. No issues there. Okay, you can go ahead and switch sides for me and place your finger on your left nostril. And take another breath. Okay, very good. No issues. So we'll go ahead and get started. I'll just take one of my vials here. And I'm just going to be dabbing the smell onto this smelling paper for you. Okay? Go ahead and again cover your right nostril and tell me what you detect with your left nostril, please. Lavender. Perfect. Go ahead and switch nostrils for me. So cover your left nostril. All right. And let's test this side. What do we detect? Vanilla. Perfect. Very good. You can go ahead and uncover your nostrils for me. So, we'll test both sides now. What can you smell right here, please? Coffee? Good, perfect. And I have one more for you. And one more time, what can you smell? Apples. Perfect. Well, no issues there, it looks like. So now we'll move on to the bulk of our test. It's just going to be a series of different eye examinations. Have you noticed any issues with your eyes? Okay, do you wear glasses or contacts? Contacts. Alright, good. And have there been any changes in that prescription? Okay, good. So first, we're going to do a little vision test. I have this chart here. I'm sure you're familiar with it. If you can go ahead and cover your right eye, please. Okay. And what's the lowest line you can read on this chart? Right here? Okay. So we'll go from the right. Can you tell me what this letter is? Right here? Okay. And this letter? Right here. Okay. And this letter right here, please. Okay, very good. You can go ahead and cover your other eye. Good. And what's the lowest line you can read here? This one as well. Okay, we'll go from the left. What is this letter? Good. And this one? Good. And this one? Very good. You can uncover both eyes. And can you read this line? Okay, very good. Can you read this line right here? Okay. Okay, good. No issues there. Just put that on my table. All right, and now I will be taking a close-up look at your eyes here and just testing your pupillary reactions. So if you can go ahead and cover your right eye for me. Okay, good. Just be taking a look in your left eye here. Okay. Okay, switch eyes for me. Okay, you can uncover both eyes. Okay, everything looks good. I'll give your eyes a little break. Next, I'll just be taking a close-up look at your retinas. So whenever you're ready, go ahead and cover this eye for me, please. Okay, good. Just stare straight ahead and try not to blink. Okay. Stare straight ahead. And look up for me, please. Okay, and look down for me, please. to your right, and to your left. Okay, good. Cover that up for me, that eye up for me. Okay. So stare straight ahead with your other eye. Good. Straight ahead for me. Okay. And look up for me. Okay, and look down for me, please. Okay, and to your right. And to your left. Okay. Very good. Everything looks nice and healthy back there. So, now we are just going to continue with a few more vision tests. Okay? So the first thing I'm going to have you do is cover up this eye for me. Good. And just let me know when you can see my fingers wiggling, okay? Okay. 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 Good. Good. Very good. You can switch eyes for me. Okay. And again, let me know when you can see my fingers wiggling, okay? Okay. 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 Okay, very good. Uncover both eyes for me and point to the side that the fingers are wiggling, or just let me know which side has the wiggling fingers, okay? Okay, ready? Okay. 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 Okay, very good. Now you can stare at the tip of my finger. Alright, and I'll go from the tip of my finger to the wall behind me and back, okay? Very good. Now continue to stare at my fingertip and just follow my finger, please. Checking for double vision, tension, any double vision anywhere. Okay, good. Very good. All right. Now, I have this pin here. Can you cover this eye for me? Okay, what color is this pen? Blue. Very good. Cover your other eye for me. And what color is this? Blue. Good, yes. Now, uncover that eye. Color is this? Blue, yes. Are they all the same color blue? Okay, no differences? Okay, perfect. Now if you'll just look at the tip of this pen and tell me when this leaves your vision, okay? And then tell me when it comes back. So just stare straight at my nose. Let me know when it leaves. Okay, and when it's back. Okay, good. Okay. 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 Very good. So I don't see any issues with that either. Everything is looking very good so far. Right. So next I'll just be testing a few facial sensations with my gloves on. So first, I want you to stare straight ahead and try not to blink. I'm just going to tap your forehead and temples, okay? Just try not to blink. Okay. Okay. Very good. Now, I have this feather right here. It has a sort of pointed but dull end, and of course it has the very soft end. Okay, feel the dull end for me with your fingers. Good, and feel the soft end. Okay, good. Now stare straight ahead with your eyes open and just don't mind me. Continue to stare straight ahead for me, please. Okay, good. Go ahead and close your eyes and let me know when you feel this. Okay? Close your eyes. Okay. 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 Very good. I also have this cotton swab. It's very soft, of course. Go ahead and feel it with your fingers. Good, soft, right? So go ahead and close your eyes again and let me know when you feel the cotton swab. Okay. 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 Okay, very good. Now keep your eyes closed for me, please. And tell me if what you feel is rough or soft, okay? Rough, yes. Soft, yes, correct. Rough, yes. Rough. Rough. Soft. Soft. Rough. Very good. Alright, you can open your eyes now. Go ahead and raise your eyebrows like you're surprised. Very good. And scrunch your face together like you're mad. Okay, good. Blow out your cheeks like you're a pufferfish. Okay, good. Go ahead and close your eyes and try and keep them closed like you have soap in them, okay? I'm going to try and open your eyelids, right? But don't let me. Okay, and... Okay, very good. Now if you can show your teeth and clench your jaw for me, please. Just feeling for any asymmetry. All right. If you can close your mouth for me. Now I'm just going to lightly tap just below your chin, okay? Okay, very good. Right, almost done here. So, now if you can look all the way to your left for me, turn your head all the way left. Good, and hold it. Okay, good. Now turn your head all the way to your right for me, please. Hold it. Okay, good. Any pain or tension in your neck or the back of your head while doing those exercises? No, okay, good. Now if you can look up all the way to the ceiling. Okay, good. And look down, please, to the ground. Okay, good. Any tension there at all? Good. Perfect. Shrug your shoulders for me. Okay, keep them shrugged. I'm going to try to push them down, but don't let me, okay? So push. Okay, good. Now if you can extend your arms for me, like you're a zombie, keep them parallel to the ground, and your palms up, okay? And just keep them steady. Okay, good. Now close your eyes and just keep them straight and steady for me, please. Steady as you can. Okay, very good. You can open your eyes. Now I'm going to try and push your arms down, but don't let me, okay? So push up. Okay, good. Now I'm going to try and push them up, but don't let me, okay? Push down. Okay, good. Now rotate your arms inward for me. Thank you. I'm going to try and push your arms out, but push against me, okay? So push. Good. I'm going to push them in. Don't let me, okay? Push out. Very good. Very good. So, our last part of your examination today, we are just going to do a quick hearing test, okay? So, first thing is I would like you to close your eyes, and I'm just going to make a soft noise in your ear. Just let me know which side, okay? Okay, good. Close your eyes. Which side is this? Okay, good. This. Okay. This. Good. And okay. Good. You can go ahead and open your eyes now. Perfect. So the next test, so I'm just going to whisper a word in your ear, and then I want you to repeat that word back to me, okay? Okay, so lamp, lamp, good, okay. 33, yes, okay. Bear, very good, bear. And last one, okay. Vacuum, vacuum, very good. So, our last portion of your test, I'm just going to repeat what I just did, except I'm going to be making a soft noise in your opposite ear. So just repeat back to me. the word that you hear, okay? Okay. So, laptop. Laptop. Very good. And wait. Wait. Very good. And book. Book. Very, very good. So, that concludes your examination with me today. Thank you for coming in and taking care of your neurological health with us today. We'll just give you a call whenever our calendar opens up for your next exam. All right? Thank you. Oh, hello there. My name is Dr. M. Welcome to our eye clinic. I'll be the one performing your eye exam today, okay? Yeah, you can go ahead and have a seat. That's good. So, I have your chart right here pulled up, and I see that you were referred to us by the other Dr. M. Is that correct? Alright. And you're having some issues with your depth perception? Okay. So hopefully we'll be able to get to the bottom of that today. Okay. So I've just got a few more questions for you here. So it says that you've got a bump on your forehead. You hit your head. Can you tell me about that? Okay, about up there. All right. Got it. Okay, so some slight difficulty with your vision. Okay. Sounds good. Well, not good, but we can work with that. Okay. So I'm going to go ahead and have a feel of that bump. Let me flip my iPad around here. So, this bump on your head, how would you rate the pain when you first bumped it? 1 to 10? Okay. And did you have any other difficulties, maybe smelling, tasting, facial sensations, anything like that in the weeks following this bump? Okay. Go. There you go. Okay, so up here, correct? Okay, and how long ago was this? Okay. Interesting. So it still hurts. Okay. Got it. Okay. How about this side over here? Nothing. Okay, good. And all the difficulties seeing you've noticed with this eye? Okay, no difficulties over here? Okay. Gotcha. Okay. Alright. So I do have a few more questions for you here before we get started. Have you had any difficulty watching 3D movies, since you've hit your head? Okay. Yeah, all of these questions will be since you hit your head and started having difficulties, of course. Okay. And have you felt dizzy or nauseous since this accident? Okay, how many hours per day would you say? Okay. Do you currently have a driver's license? Okay. And do you have any difficulty driving, particularly when stopping? Okay. Do you play any sports? No, okay. And have you noticed yourself knocking things over often, being a bit more clumsy? Okay. All right. So that's the end of those questions. The first thing I'm going to do is just get a few eye measurements, pupil measurements, okay? So if you can look straight ahead for me and try not to blink, but blinking is okay. Okay. Just going to line this up right here. Okay. Make sure that it's looking like. Okay. Then on this side. Okay, I'm looking for any asymmetry. Okay. Okay. Looks pretty typical. I'll be typing all my notes on the iPad for today. Alright. So, this first test I want you to do for me, I have these two sponges right here, and I want you to estimate for me when they cross paths with each other, okay? So I'm going to hold one a little bit more forward, and I'll hold this one a little bit further back, and I want you to go ahead and tell me when you see them cross in your line of sight, okay? Okay. 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 Good. Now I'm going to use these two combs, and I want you to do the same thing for me, okay? Okay. Just let me know whenever they cross in your line of sight. Okay. 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 Right. And we're going to do that one more time, but I'm just going to dim the lights just a little bit, okay? Okay. Okay. Ready? Alright. So just when they cross. Okay. Okay. Very good. Bring those lights back up. Okay. So, pull your notes back up. The next test is I have a few plates here. I'm going to have you be taking a look at them. Let me find which one I want first. Looks like this one. Okay. So this is the easiest one. I just want you to have a look at these plates, and there should be an outline of a circle in one of these boxes, and I just want you to tell me which one, okay? So, which one has the outline? Okay, just going to turn it. How about now? Which one has the outline? Okay. And how about now? Okay, very good. Let's see. Okay, and now I have the second plate. So I want you to have a look here and let me know which one has the outline on it. Okay, just flip it. How about now? Which plate has the outline? Okay, and one last time. Okay, very good. And our last plate should be the hardest. So if you can, go ahead and let me know which plate has the outline. Okay. And now. Okay. And how about now? Last one. Okay, very good. Thank you. So, let's see here. It's a bit of difficulty with the distance third. Okay. Alright. So now I want you to go ahead and play another game with these objects for me. I'm going to break out the sponge again, and the first thing that I want you to do is I'm going to have you estimate how far away this sponge is, okay, in inches. I want you to go ahead and cover this eye for the first time, okay? Okay, so just let me know how far away this looks. Alright, rough estimate. Now? Okay, how about now? Okay, and now? Alright, how about now? Okay, you can switch eyes. Okay, how far away? In inches. Okay, how about now? Okay, how about now? And now again. Okay, very good. And I want you to go ahead and do the same thing for me, just with this comb. So we'll start with this eye this time, okay? Cover up. Okay, good. Good. Excellent. And good. Okay, you can switch eyes. Okay. So, how far away? Okay, good. 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 And good. Okay. Now you can uncover both eyes. Alright? And let me know how far away. Okay? Good. 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 Okay. Okay. Very good. All right. So next, I'm going to have you put on this special pair of glasses, okay? Let me clean them for you. They get just a little bit dusty. Okay. So you can go ahead and close your eyes for me while I put these glasses on. Okay, thank you. Okay, open. Perfect. Feel okay? Okay, good. So, if you could take a look for me at this piece of paper. So on the top and bottom, there should be a shape that is seems 3D or is popping out at you a little bit more than the others. If you could let me know what that shape is up here. The triangle. Okay. How about down here? The square. Okay, very good. Very good. Thank you. All right. Now, I'll go ahead and take those glasses off. If you could close your eyes again. Okay. Okay, very good. You can open. So, it's about the middle of our test. We're halfway done. I'm just going to give you some eye drops so your eyes don't get too tired, okay? So we'll just moisten them up. Okay. Look up. Okay. Your other eye. Okay. Very good. Blink, 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 blink. Okay. Good. And those don't burn. Anything like that? Okay, very good. No issues with eye drops. Alright. So now I'm going to bring out some objects once again. Let's see. I'm going with these this time. Okay. So I have these two pen lights, and I just want you to tell me which one is closer, okay? The pink one or the white one, alright? So if you can go ahead and cover up this eye for me, we'll start with your right eye, right? Okay. So, which pen is closer? Okay, now. And now. 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 Good. 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 Okay. Very good. Now here are our combs again. You can do the same thing. You can go ahead and switch eyes now. Okay. So, same thing. Here we go. Good. 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 Okay. 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 Good. Uncover both eyes. Okay. We'll go back to our fun pin lights. Ready? Same thing. Okay. 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 Right. Right. Okay. Okay. Very good. Good, good, good. And I'm also going to dim the lights one more time. And we'll do that test with both eyes again, okay? Okay, ready? I'll use these two. Ready? Both eyes. Okay, which one is closer? Okay. 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 Right. Okay, very good. Bring those lights back up. And there we go. All right. Okay. So, I'm going to put another pair of glasses on you. They look very similar, but they are different. Just cleaning them off for you again. Okay, so close your eyes for me. Okay, there you go. And for this test, if you can look at this plate for me. Okay, there should be a triangle, a circle, and a pentagon somewhere on this paper. Can you just point to where the triangle is? Okay, and the circle and the pentagon. Okay, very good. Just take those glasses off. You can close your eyes. Okay, thank you. You can open. Right. Okay, so we have our objects again. These two combs, and I want you to tell me. I'm going to say 2 inches, 6 inches, maybe 12 inches. If I have the room right here, I should. And I want you to tell me when these two objects look to be that far apart. Okay? Just approximate. Okay, so we'll start with your right eye again, so if you can go ahead and cover the side. Okay, good. So go ahead and tell me when these are 2 inches apart. Okay, and now about 6 inches. Okay, and now about 12 inches. Okay, good. You can switch eyes. Okay. So, I'll switch combs. Let's go with, tell me when they're 6 inches. Okay, and 12 inches. Okay, and 2 inches. Okay, now we can go ahead and do both eyes. Okay, very good. So let's go 6 inches. Okay, 2 inches. Okay, and 12 inches. Okay, good. We are almost done. Alright, now the last thing I'm going to ask you to do is I'm going to hold up my finger. If you can just look at the tip of my finger and follow it, okay? Okay, and now if you can look at the tip of my finger again and bounce back and forth between my finger and back on the wall, okay? So look at the wall, finger, wall, finger, wall, finger, wall, finger, wall, and finger, wall. Okay, very good. Excellent. Okay, type the last few things here. Okay, so I'm seeing that you are definitely having some difficulty with your depth perception, okay? But we'll get it all figured out, particularly in this eye closest to where you were bumped or where you bumped your head, okay? So what I'm going to recommend is we just schedule you to come back as soon as possible. We might have some appointments available tomorrow if that works for you, but we're going to get you back in here and do a few retina scans with our imaging machines, and then we'll talk about your options, okay? Okay, we'll get it all figured out, don't worry. Alright, well, thank you for coming in today. I'm so glad we were able to fit you in, and I'll see you very, very soon. Hi there. Welcome back to the ear clinic. It's great to see you again. Yes, I'm assuming everything has been going okay. Okay, that's great to hear. But we just have to ask you a couple of questions before we get started, okay? Okay. Can I have you spell your last name for me again? Okay. Always like to make sure. And can I have your birth date one more time? Okay. Great. And I just want to confirm that your address, phone number, email, none of that has changed since your last appointment. Okay, great. Oh, and your insurance, is that up to date as well? Okay, as far as you know. Okay. Right? So, again, a couple of questions. Are you currently experiencing any issues with your ears? Right? Are you currently experiencing any issues with your nose or throat? Okay. All right. Have you had any issues with your ears, nose, throat in the last 6 months? Right? And how long has it been since your last hearing test? Okay. All right. And how long has it been since you've had your ears professionally cleaned? Okay. And do you clean the inside of your ears at home on a regular basis? Okay. Do you clean the outside of your ears at home on a regular basis? Okay. How often do you go swimming? Okay. Okay. And do you use any sort of ear drops or other types of medication either in or on your ears? Okay. Okay. All right. Have you ever had an ear infection in the middle or outer portions of your ear? Have you ever had any issues with foreign bodies being stuck in your ears? Right. Do you or anyone in your family have a history of any of the following? Is the next page. Okay. Tinnitus, vertigo, deafness, acoustic neuroma, frequent earaches, excess fluid buildup inside the ear, labyrinthitis, and Meniere's disease. Okay. All right. That's all of our questions. So now we can get started. As you know, we like to clean all of our patients' ears while they're in the office with us. So we will be doing that today. And because we are cleaning them, we will do a hearing test before and after your cleaning. All right. Since, according to your records, the last time you visited us, we did a full hearing test with the beeps and the different octaves. This time it will be a more quick shortened version of the test. Okay. Alright, but we have had some fun updates to our cleaning supplies, so that will be a little bit different. Okay? Everything sound okay? Any questions so far? Great. Well, I'll go ahead and get started. So we'll start today with a basic examination of your outer and inner ear, and then we will move on to that hearing test and cleaning. And hearing test again. Okay. Getting the gloves on here. Okay, so first I'm going to gently press on your sinuses because of course they are connected to your ears. Okay? Is it okay if I touch? Perfect. So gently pressing on your front sinuses, just below your eyes, okay? Any tenderness or pressure? Okay, good. How about up here? Any tenderness or pressure? Okay. Good. All right. And now I will move on to your outer ear. And I'm going to bring some tools with me to check for dirt. Okay? So if you can just remain still, facing forward, look forward, okay? And I'll be on either side checking out your ears. Okay. All right. So we start with a general examination of your ear, making sure the cartilage is nice and strong and there are no weird bumps or lesions anywhere. Okay. And I'm going to check for dirt along your ear. Okay, and right behind your ear, okay? Check for dirt back there. Okay, just a little dirt, but nothing out of the ordinary. Okay, we're doing good. Okay. Just going to come over here to your other ear and look around. Okay. I'm not feeling any bumps or lesions or anything worrisome. Is there any tenderness everything looking good so far? You're okay? Okay, great. Now I'm just going to inspect your inner ear with my little tool, okay? So let me know at all if you are ever uncomfortable, alright, or if you feel any pain or tenderness. Okay, it's very important. Alright. So, moving on to this side, just going to nestle that in to your ear and look for any damage or fluid that might be in your ear on this side. Okay. Just making sure everything checks out. Okay. Let me just check for dirt here. Okay. A little bit of wax on the Q-tip, but nothing too major. Okay. Now on your other side. Alright, just remain looking straight ahead for me. Just going to put my tool into your ear. Okay. Once again, checking for any signs of a fluid or wax buildup, any redness. Okay. Now I'm doing a small wax test. Okay. Again, a little bit of wax, but nothing too major. Okay. Alright. You write a few quick notes here. So everything is looking great so far, but I am seeing a little bit of wax built up in both of your ears. So I'll pay careful attention to that while I am doing your cleaning. But other than that, I'm not seeing any redness or lumps, bumps, fluid out of the ordinary, okay? Alright, so I don't think you have anything to worry about. Okay. So now we'll do our quick hearing test before I do your cleaning. Okay? So I need you to close your eyes for me, okay? Just close your eyes. Okay. So first, I need you to repeat these words back to me. Okay? Alright. Truck. Yes, very good. Okay. Hat. Good. Album. Good. Very good. Okay, one more. Alright. Laptop. Good. Very good. Alright. with your eyes closed, now I need you to raise your hand whenever you hear the sound of my glove. Okay? Right? Ready? Okay. Good. 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 Okay? And keep those eyes closed. Now I need you to raise your hand on whichever side you hear my glove, okay? Okay, ready? Good. Perfect. Good. Good. All right, perfect. And now I need you to tell me which side the glove, once again, sounds loudest on, or tell me if it sounds like it's coming from in the middle. Okay. 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 Perfect. Okay, very good. Easy. Okay, so now we can go ahead and move on to your cleaning. The first thing I'm going to do is put a drape over the side of the ear I'll be working on, okay? Just to protect your clothes from anything. All right. Just put that around you. Okay, very good. So, of course, I'll be working on this ear first. Right. And first, I'm just going to dust away some dirt from the outside of your ear, okay? So again, let me know if you ever feel pain, tenderness, or just generally uncomfortable, okay? Okay, very good. Okay. So that's the easiest step. Now I'm going to take a special scraping tool and scrape out all of these harder bits of wax and dirt in your ears. big pieces out with that. So the next part is one of our new appliances. We have a water pick that I will insert in your ear. And this water pick has a special cap on it that will pump water through the water pick into the cap and spray water inside of your ear at an angle, of course, so it's not going directly in your ear, but this warm water will help dislodge some of that deeper wax, okay? And then it will just run out of your ear. Okay. Alright. So again, this will only last a few seconds. Let me know if at any point you feel uncomfortable, okay? Alright. Just going to place it in your ear. Okay. And I'm going to begin. Okay. Let's see what we've gotten out the ear. Okay. Gotten a really nice big lump out. And now what I'm going to do is just dry that ear off, okay? Then plain old paper towel. Okay. And next, let me take a quick look again with my little light contraption and make sure everything looks okay. Okay, just looking in your ear. Okay, let's see. Looks like I've got most of the wax out of the ear. Just needs to be cleaned up a little bit, especially the outside of the ear. Then they'll be good to go. Alright, that looks good. Next, we have some ear drops. I'll just put in your ears, okay? You can tilt your head to the side a little bit. Okay. Perfect. Right. Got some on my fingers. That's That's okay. And then I'm going to just spray the outside of your ear with some water, okay? To get rid of any of the wax that might have crusted on the outside, okay? Just cover. Okay. And then a quick wipe. With an antibacterial wipe to get the last of that wax. Okay. And then we'll finish with a moisturizing lotion. Okay. There we go. I'll leave that open for your other ear. All right. Just gentle lotion. Around your ear to make sure that the skin stays healthy and moisturized. Okay. Wipe the excess. Good. And we are all done with that ear. Right. So then I'll just repeat this process on your other side. Okay. So let me wipe away the dirt and the dust. Oh, I need to move the drape over. Let me just re-drape. Okay. Now, I'll dust. Okay, now the inside of your ear. Just a gentle brush. No. Okay, very good. And now some scraping on the inside Let me know if you're uncomfortable. Going to insert the water pick. Okay. Let's see. Okay, I'm going to start the water pressure now. my paper towel. Okay. Right. Do my quick look. Almost done. Just taking a quick look inside the ear, making sure I've got most of the wax out. And it looks like that I have everything looks good. Okay. Right. Now our ear drops. Okay. Right. Quick spray to the outside. Okay. And finally, a gentle wiping. And our moisturizing lotion. Okay, just a teeny tiny bit. Okay. Perfect. All done. Okay. Okay. Right. Let me remove the drape. Let's see, where's the clip? There we go. All right. And our hearing test to finish up. Okay? Close your eyes. Repeat the word back to me. Ready? Lamp. Good. Telephone. Good. Egypt. Good. Very good. You've got it. Keep your eyes closed. Which side is the noise loudest on? Okay, raise your hand. Good. 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 Middle. Okay, good. And raise your hand when you hear the noise. Good. 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 And Okay. Yep, looks like we're all done. So, according to everything that I saw during your examination today, as well as your family history, it looks like you are perfectly fine and your ears should be squeaky clean. Right. Go ahead and sign off on your paperwork. And I'll see you in a few months. Thank you so much for coming and getting your ears checked out by us once again. I hope everything goes well for you until it's time for your next ear cleaning. Thanks. I'll see you very soon. Hello. Welcome to the clinic. I'm going to be your doctor for this evening. So it says here in your file that you were referred to us by your general practitioner, that he found some things looked a little bit off during your annual visit, and he just wanted to make sure that everything was looking okay. Is that correct? Okay, perfect. So what we'll do then for today is just give you a general exam. So for this exam, I'm going to be coming up close and touching you. Do I have your consent for this part of the exam? Okay, great. So we can just go ahead and get started. For this first part of the exam, I'm just going to be taking a general look at you, getting your appearance at rest. My gloves on. Tight fit. Okay, so let me get a look at you here. Have you noticed any problems with your breathing, whether when you're exercising or at rest? No? Okay, great. And how about any abnormal swelling or pressure? Okay, great. Here. Okay, great. So the next part of the exam, if you can go ahead and put your hands out like this, and I'm just going to take a look at them really fast. Thank you. So I'm first going to look at your fingernails, and I'm just checking and looking for any curvature, signs of clubbing, and any spots on the nails. I am also palpating your hands and making note of the general temperature and texture of your hands. If you could turn them over for me, please. Thank you. And if I may ask, do you have a family history of heart disease on either side? Okay, very good. Okay. Hands look good. Okay. And next, I'm just going to be feeling your pulse in a few places along your arm. First, on your elbows. Okay. On your other elbow. Okay, and now on your wrists. On your other wrist. Okay, that all looks good. Next, do you have any shoulder pain? Okay, great. So what I'm going to ask you to do is I'm going to place my hand on your wrist pulse, other hand on your shoulder, and I'm going to ask you to lift this arm up, gently briskly. Okay. There we go. Very good. And I'm just checking for a collapsing pulse here. Okay, good. Put that arm back down. Let me go over to your other side here. One hand on your pulse, on your wrist, other hand on your shoulder, and up. Okay, you can go ahead and put that arm back down. Thank you very much. Okay, everything is looking fine so far. So for the next portion of the exam, I'm going to be coming up close to you, and I'm going to ask that you close your eyes. We can go one at a time here. Get my glasses on. Okay, so if you can close this eye for me, I'm just going to be checking your eyelid for any cholesterol deposits. Okay, you can open, and I'm going to pull down your under eye and check for any hemorrhaging. Okay, good. You can open that eye. Go ahead and close this eye. Okay. Okay, good. And open. Pull down eyelid. Okay, very good. Now keep both eyes open for me. And I'm just going to be checking for any retinal spots. Okay. Other side. Okay, very good. I don't see anything there that should be a problem. And lastly, I'm just going to ask you to open your mouth for me. Okay, and lift your tongue. Okay, very good. Still no problems. Okay, this next step, I'm going to be feeling your temples and your neck. And I'm checking for any abnormalities in the pulse and palpating for temperature, texture. Okay. Your neck. Okay. I'm just breaking out my stethoscope. Okay, and I'm just going to place this on your temple. Okay, to the other side. Okay, moving down to your neck. Okay, I'm just going to check your jugular. If you can please breathe in and hold it. Okay, and breathe out. Perfect. Next, I'm just going to be taking a look and measuring your jugular venous pressure. Just going to get my ruler right here. Okay, lining that up. I'm going to take this flat surface. Okay, looks like it's about. Okay, very good. Still no issues. Let's see. Okay. Good. Now I'm just going to look over the 5 main regions of your chest. So first I'm just going to be checking for any abnormalities, pressure, or scarring, okay? And changes in height as well. So I'm going to start with your aortic region. Okay, your pulmonic region. Okay, down to Erb's point. Very good. And your tricuspid region. And lastly, your mitral region, right under there. Okay, that looks good. Now I'm just going to take a listen to each of these 5 regions. You can just breathe normally. Okay, let's move into your aortic region. Okay, your pulmonic region. Good. See your Erb's point. Okay. Tricuspid. Okay, and mitral. Okay, very good. I'm just going to move back up to your pulmonic region, and if you can lean forward for me, please, and let all your breath out, exhale, and hold it, okay? Okay, you can breathe normally. Thank you. Very good. And lastly, I'm just going to apply a little bit of pressure to your chest. Just continue to breathe normally, okay? Here we go. Okay, do you feel any discomfort at all? Okay. Okay, right here. Okay, very good. Let's see here. It looks like we don't have any issues. I'm not seeing anything. So you can go ahead and sit back and relax for me. However, regardless, we will send on our results to your general practitioner from today so we can keep him in the loop of what's going on. All right? So the nurse should be back in a few moments to finish up, and she'll walk you up to the front. Do you have any questions for me today? Okay, good. Well, it's very nice to meet you. Thank you so much for coming in to get your heart checked with us today, and I hope you have a good rest of your evening. All right, bye-bye. Hi there. It's good to see you again. Welcome back. I hope that you've been doing well. So, I've got your chart right here, and I see that you've come in to visit us for your annual checkup. Is that correct? Okay, great. Annual checkups are very important, even when we think there is nothing wrong. There is nothing wrong with making sure. So you can go ahead and walk over to the examination table, and if you can take a seat just on the edge there. Okay, good. I'm going to sanitize my hands. And go ahead and get my gloves on. So I've looked at your chart, at the information that you filled out for us, but I do want to confirm that you've had no changes in your medical history. Okay. And no changes to your medications. Okay. Alright. Let's see. No significant changes in your height and weight. That's good. Okay. And I do see that your temperature that the nurse took is just a little bit high, but that's okay. I'm going to go ahead and recheck it and just to make sure we got an accurate reading, alright? No worries. Okay. So, go ahead and do that. You can just look straight ahead for me, please. Just going to line this with your forehead. Okay, to take a few readings here, just to make sure that we get an accurate reading. Okay, much better. That can happen sometimes when it's hot outside and our patients come in from the heat. So you're perfect, 98.6. No worries there. And I did also see on your chart that you indicated that you were interested in a flu shot this year. Okay, good. So I can go ahead and do that for you at the end of your physical exam today, okay? Okay, great. So we can go ahead and get started. I'm first going to take a listen to your heart. So I'm going to ask you to breathe normally for me, okay? Alright. Just going to place that about right here. Right there, okay? Just breathe normally for me. Okay. Alright. It seems like your heart is beating a little bit fast. Are you worried about the vaccine? Alright, that's understandable. So let's just take some deep breaths and then I'll take another lesson, okay? Alright, go ahead and breathe in for 8 counts, hold for 5, and then slowly release. Alright, I'll do it with you. In, 2, 3, 4, 5, 6, 7, 8. Hold, 2, 3, 4, 5. Slowly release. Slowly release. Slowly release. Okay. Feel better? Okay. Good. Let's take one more lesson. Alright, so just breathe normally. Just find your heart here. Okay, very good. side. Let me just get that right there in the position. Okay. Come down here. Okay. And now I want you to breathe like you're disgusted. Alright, like we just told you we were having problems with your insurance. That's always frustrating, right? Just going to place the stethoscope about right there. Just breathe disgusted. Very good. I'm going to come around the back. Just keep taking disgusted breaths. Just going to move it a little bit. Okay. Very good. That all sounds normal. Alright, your heart sounds very strong and healthy. No issues. Okay. Right. So now I'm going to take your pulse. Let me just find your radial artery over here. Finding your radial artery. I'm going to count that. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Okay, the pulse is normal, about 74. And next I'm going to take your blood pressure. Alright, so if you can roll your sleeve up for me. To get this situated on you, on the side. Okay. Just listening to the blood pressure. Looks okay. Alright. Very good. Very good. About 115 over 70. So, looking very nice. Next, I'm just going to do a visual inspection of your skin on your face. Right. For all things line up, I'm going to move in a little bit close here. And I'm looking for any signs of lesions. Noting the tone, the temperature, and the texture of your face. I am going to test cranial nerve number 5. And I want you to close your eyes and tell me when you can feel me touch you, okay? Okay, so close your eyes. And when I touch you, say now, okay? Okay. 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 Very good. Cranial 5. Nerve 5 seems to be working perfectly. Alright. So now I'm just going to take a look at your eyes. Right, I'm gently going to pull down on your eyelids and look at the conjunctiva. Make sure that they are moist and pink. Okay, looks very good. Alright, I'm going to close your eyes against your eyelids. Okay, try and open. Okay, very good. So now we are going to do a small vision test. I want you to have a look back here and read the smallest line you can read with this eye. Okay, very good. And now with this eye, read the smallest eye you can read back to front. Okay, very good. Good. Right. Okay. And now I'm going to take my pen light here and I want you to stare straight ahead. Right. And I'm going to move my light in and out of your vision, checking the depth of the cornea and your pupillary reactions, direct and concentrol. Continue staring straight ahead, please. Okay. Just going to get up close with my light here. Continue staring straight ahead. Okay, now look at me. Look back. Okay, good. Stare straight ahead. Okay, look at me. And look back. Okay. Very good. Now if you can just follow the tip of my finger. Okay, perfect. Your eyes adjust to both near and far-sighted vision. Perfect. Okay. No retina scarring or distortion. Alright. Next, we are going to do a quick hearing test. I'm going to wiggle my fingers in one of your ears, and you can just raise your hand whichever side you hear my fingers on. Okay, so go ahead and close your eyes for me. Alright. Good. 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 Perfect. And now I'm going to inspect the outside of your ears. Okay. So just getting up close here, looking outside of your ears, looking for any lumps or swelling, lesions, echymosis, or tenderness. Do you feel any tenderness right here? Okay. Right, and on your other side, just pulling the hair back from your ear and inspecting the lobe for swelling, tenderness, lesions, right, tenderness. Okay, perfect. I'm going to take a look inside. Alright, continue to relax. Okay, good. Just going to pull the piano back and check the inside. I'm going to note the color of the inner ear. I'm looking for fluid inside in the middle of the ear. Okay, the shape of the canal, everything looks very excellent and good. Alright, now the other side. Moving the hair back again. Looking at the color of the inner ear. Checking for any signs of fluid. Okay. Excellent. Ears are looking great. Right. I'm going to palpate your nose and cartilage, nasal bones, any tenderness. Okay. I'm going to look into each nostril and check for swelling or inflamed tissue or deviated septum. Alright. Now if you could open your mouth for me. Okay. Alright. Check for glands. Make sure everything is working. One. I didn't lift your tongue. Okay, perfect. Make sure the teeth look okay. Right. Very good. So, the last step here is I'm just going to examine your lymph nodes around the base of your jaw, down into your neck. Okay, and on this side. Okay, and I'm going to come around to the back and feel right in your neck. Make sure there's no swelling or lesions, any lumps. Alright, everything feels normal. So, we can go ahead and get your flu shot taken care of, okay? Do you have any questions about your exam? Alright, great. Wanted to make sure before we move on. Okay, this will be very, very quick, right? There you go. Alright, I'm going to add and put it in this arm. Just going that arm loose, okay? Shake it out. Keep it loose. This will be very quick. Just a pinch. Alright? Ready? Okay. Deep breath in. That's your favorite dessert. Favorite dessert. Favorite dessert. Okay. All done. Quick and easy. What was your favorite dessert? Very good. Here's your Band-Aid. Okay, all done. So, thank you very, very much for coming in to see us. We love seeing our return clients. And if you don't have any further questions, I am signing off on your physical, and I hope you have a great next 12 months, and I see you in about a year's time. Alright? See you next time. Hello. I'm gonna be your eye doctor today. How are you? Are you comfortable? Great. Well, let's go ahead and get started. Let me fire up the computer. Can I have your last name? Okay. With a B. Okay. And your date of birth? Okay, here you are. It looks like this is your first appointment with us today. We're so glad you're here with us. When was your last eye checkup? Okay, not too long ago. And are you currently experiencing any significant issues today that we can help with, such as, blurriness, tired eyes, any pain? No? Okay, good. Have you or your family ever been diagnosed with an eye condition, retinal or otherwise? Okay, great. And if you had to give an estimate, how many hours per day do you spend looking at computers, other screens, watching TV? Okay. And do you currently wear glasses or contacts? Contacts. And do you remember your prescription? Okay. Yes, just an estimate is fine. And are you currently wearing those contacts today? No? Okay, great. Awesome. We can go ahead and get started with your examination. The first thing I'm going to be doing is just taking a quick measurement of the distance between your pupils. So if you will just sit very still and look straight ahead, this will be really fast. Okay, happy with that. That's right. 5. Okay. Yes, perfectly normal. Okay, and the next thing I'm going to be doing is I will get a little close to you, and I will be touching your temples, under your eyes, in the middle of your face, your forehead, just to make sure there isn't any tenderness, pain, anything like that. So I will be wearing gloves so I do not mess up anything on your beautiful face. Okay, is it okay if I touch you? Okay, great. So I'm just gonna go in by your eyes, your temples. Feel a little bit of pressure. Now, do you feel any pain or tenderness anywhere? Okay, great. I'll go down to under your eyes. Press a little bit. Do you feel any pain or tenderness here? Okay, great. Just go up to your forehead. Any pain, tenderness? Okay, great. Awesome. Just take these off. Okay. So, the next thing I'm going to do is I am going to use this pin light, and I'm just going to check your retina health. So if you will just stare straight ahead, go ahead and look at this ear for me while I take a look at this eye over here. That on. Thank you. Okay. Okay. Okay, perfect. You can go ahead and look at this ear now. Okay. Okay, great. Now just stare straight ahead for me at my nose. Get both of them together. Okay. I'm gonna move in just a little bit closer. So continue to stare straight ahead for me. Okay. Okay, they look good. Now we will just test your peripherals. So I'm going to cover up this eye. We'll do this eye first. And I just want you to look at the tip of my little stylus here and just let me know when you can't see the tip of this stylus anymore, okay? I'll just cover up this eye for you and just watch the tip of my pen. Okay? Okay? Okay. Okay, perfect. I'll just cover up this eye and just let me know when it goes out of your field of view. Okay? Okay? Okay. Okay. Great. Perfect. Very well. Just write down a few things. Okay. Very good. So next, I'm gonna have you look into this very scientific scope that I have. This is actually some new technology we are trying out today. So if you will just look straight in here and focus on the image in the back for me. Okay. That might go in and out of focus as we zero in on your prescription. All right. Perfect. So you'll just look straight into here. Okay, perfect. Just keep looking at that image. Focus. Okay, perfect. Very good. Thank you. So let's just get the reading on that. Okay. Okay, perfect. Okay, so the next test we are going to be doing is I have a few lenses here, and I'm just going to ask you to look at this chart behind me. Any of the rows is fine, and I'm just going to be moving these lenses around and trying a few to get to your prescription. So, just get these all set up. Okay, and we'll go ahead and start with this eye. Okay, so we'll go ahead and cover this one up. Okay, maybe I can get a sheet of paper. Better. Okay, covering this one up, and just look at this sign behind me. Okay. So is it better 1, better 2? 1, 2. Okay. Is it better 3? Better 4? 3 or 4? Okay. Better 5? Better 6? 5? 6? Okay. Better 7? Better 8? 7? 8? Okay. Very good. Just write that down or type that in here. Okay, and we'll go ahead with this other eye. So you can look at this chart over here this time. And get everything set up for you. Okay. Go ahead and cover this eye. Okay, so better 1, better 2. 1, 2. 1. Okay. Better 3, better 4. 3, 4. Okay. So better 5, better 6. 5, 6. Very good. Just type that down. Okay. So, let me just fit these lenses into these glasses here. Click. Okay. So now these glasses have your prescription in them, and I'm just going to put these on you for our last few tests. Just stick those on you. Okay, looks good. So with those glasses on, I'd like you to read a few lines on my chart back here. Let me grab a different color. Okay, a few lines on this chart. So can you start with this line for me? Okay. And can you read this letter? Okay. What about this letter? Okay. Can you see anything down here? Okay. And this line, please. Okay. Perfect. Okay. And it looks like that is the right prescription for far away. I just have this close-up chart for you that'll just have you read a little bit on to make sure you can still see up close with that prescription. Okay. Just hold it for you. And can you go ahead and read this line? Okay. And this line? And let's try, can you read anything from this line? Okay, a little too small. About this one? Okay, perfect. I think we are just about all done. Actually, I think we are all done. So looks like that prescription is going to work for you. It didn't change too much from your original prescription, which is good. Do you have any more questions for me? No? Okay. Awesome. Great. Well, thank you so much for coming in today. And if you'll just follow me, I'll lead you back to our receptionist and she'll get you all checked out.